Hi, today we gonna talk about suprarenal gland diseases. They are Conn syndrome, Cushing syndrome, adrenogenital hyperplasia, Pheochromocytoma, and Addison disease. These diseases are characterized by increased or decreased hormones that produced by suprarenal glands. First, Conn syndrome happens increased secretion of aldosterone hormone of zona glomerulosa. That responsible for sodium and water reabsorption, so happens hypernatremia and hypervolemia, leading to hypertension. And responsible for the excretion of hydrogen ions and potassium, so happens metabolic alkalosis and hypokalemia, leading to involuntary muscle contractions and muscle weakness and arrhythmia and constipation. The cause may be primary, is unilateral or bilateral adenoma of zona glomerulosa or hyperplasia. Then we name it primary hyperaldosteronism. May be secondary, is renal artery stenosis, heart failure, nephrotic syndrome and the pregnancy. Then we name it secondary hyperaldosteronism. Second, Cushing syndrome. That characterized by increased secretion of cortisol hormone of zona fasciculata. That is responsible for insulin resistance, so happens glucose intolerance. And responsible for catabolism, so happens muscle wasting and thinning of the skin. And responsible for redistribution of fat in abnormal sites, is back of the neck and the face, so appears moon face and buffalo hump. And has anti-vitamin D action, so may happen osteoporosis. And increases hydrochloric acid in stomach, so may happen peptic ulcer. And increases red blood cells, so happens polycythemia. And has androgenic action, is on females due amenorrhea and hirsutism, and on males due impotence. And the most important, has anti-inflammatory and anti-allergic effects. The cause may be adenocorticotropic hormone dependent, meaning the cortisol hormone follows adenocorticotropic hormone, as in pituitary adenoma. Or the cause may be adenocorticotropic hormone independent, meaning increase in cortisol hormone even the adenocorticotropic hormone high, as adrenal adenoma, or exogenous administration of excess steroids. Third, adrenogenital syndrome, that characterized by increased secretion of androgen or sex hormones of zona reticularis. That is responsible for gametogenesis and secondary sex characters. So on males do pseudo-precocious puberty, like musculinization and deepening of the voice but without spermatogenesis and small tests. And on females do virilism, meaning musculinization and amenorrhea and hirsutism. The cause is exactly like the cause of Cushing syndrome. Fourth, Addison's disease, or adrenal insufficiency, or chronic adrenal failure. All of them meaning decreased secretion of all hormones of adrenal cortex, not specific to one hormone. And comparing to last three syndrome, happens the opposite. Meaning hypoglycemia and hypotension, so happens drowsiness, lack of concentration and coma. And happens polyuria, vomiting, nausea, and loss of axillary and pubic hair in females, and hyperpigmentation due to high adenocorticotropic hormone. May complicate to Addison's crisis, which is a medical emergency, that may be fatal if not recognized and treated immediately. The cause is idiopathic atrophy, or autoimmune disease, or surgery, or irradiation, or hemochromatosis, or sarcoidosis. Fifth and finally, pheochromocytoma. That is hyperfunction of adrenal medulla, so increased catecholamines which they are adrenaline and norepinephrine. That I think it's not the first time you heard about them. So the patient mostly comes with paroxysmal hypertension, paroxysmal tachycardia, paroxysmal headache, paroxysmal sweating and anxiety. Thank you for listening. I hope you learned something. Thanks again and subscribe for more.